Johnson, the mental health coordinator. How are you doing today?
I'm doing well. Thanks for having me.
What caused you to become a mental health coordinator?
So, I grew up in a large extended family, and I learned from an early age that I had to advocate for myself and others. And so, I really wanted to work with people to empower them to advocate for themselves.
Do you think being a mental health coordinator affects your mentality?
Being a mental health coordinator can definitely affect your mental health in, both positive and then sometimes distressing ways, if we're honest, right? But I think it's really key that anyone in any profession seeks out support, to process the daily life challenges that you may encounter in the workplace, right? So, with any role, I encourage anyone to seek out therapy.
What do you think is harming kids' mental health today?
So I don't think that it's one cause in particular. There could be lots of factors: genetics, environmental, stressors, discrimination, right? But I think that one of the things that I often think about is isolation and a loss of community. I think it's really key that our youth and our kids feel connected to others in the community, feel supported, and can experience moments of joy in our community. So we're really working to create that for our students.
Is there anything or we can do to help mental health?
Yeah, so I think that teens and kids, right, play a crucial role. If we're honest, right, we know that students are going to go to other students to talk about concerns or feelings, right? We'd love for them to come to the adults in the building, but recognizing that teens are going to seek out other teens is really important. And teens can provide mental health first aid to other teens. And so I encourage teens to be supportive, lend a listening ear without judgment, listen to learn, yeah, and then not just respond. But then also, I think it's really important for teens to know when to call in for support, right? So the school counselor, Miss Parker's here, I'm here to be tapped in when you feel like, my friend could use additional resources, support that's outside of your scope, right? But I think that we know that teens are going to go to other teens first, so preparing our students to provide that first, mental health aid is key.
Do you have anything else you would like to share with our viewers?
I do. So I thought about 5 tips for a happy and healthy semester. And so the first tip would be to really set small goals for yourself, set actionable items that you can check off a list. It'll help you feel, stronger in your skills. And then I also thought about the need to prioritize rest, so making sure that you're scheduling downtime, that you're getting enough sleep. That's really key. I also thought about the need for connection, right? So I mentioned isolation earlier, and I think connecting with our peers and setting time aside for friends and family is key throughout the semester, and then practicing some self-care. So whatever that may be for you, whether it's journaling, going for a walk, making sure that you're hydrating, right? All key. Scheduling an appointment with your therapist. And then also I thought about the last one is, I know that sometimes, our hours here at school are thought of as 7 to 3, right? But not everything is going to happen between those hours. So remember, you're not alone, and you can always utilize 988. That is a hotline that is available 24 hours a day for anyone that's experiencing emotional distress or some mental health challenges, or if you are trying to assist someone in your life that may be experiencing mental health challenges or emotional distress or substance abuse, you can always call that hotline. They're available 24 hours a day, and they will link you with a mental health professional. So remember, you're not alone. We're here to support you. We care about you, and we want to see you all healthy and thriving.
Okay, guys, that's all for today. We will see you next time here on SES Network and Dog Talk. Thanks for watching.